questions and sharing your contact information as you like.
How do I do this? All right.
So we will wrap up here with Kessler, Rutgers. Thank you. Thanks, NYU.
Ooh. That's the sound. All right. Good evening, everyone. Thanks for joining us. We're just going to wrap it up here. We're glad to go last. My name is Kathy. I'm one of the chief residents. I think we have all our chief residents here today.
Hi, I'm Marlene. I'm the academic chief resident.
And I'm Dan. I'm the administrative chief resident.
All right. So actually, let me minimize that. So hopefully you guys can see that. So the way that we structure this is, I know that a lot of you are fourth years and it's a really stressful time because everything's changed and everything's going to be virtual. So our plan for this evening is that the 10 minutes is going to be a lot of the highlights and things that you might not see on our website, which has a lot of great information on it. And then our last 10 minutes will be for questions that we're an open book today where we'll give you our frank opinion about anything about our program and then just applying in general. So let's get started. All right, so this is our program roster for this year. We have 8 accredited ACGME spots, sometimes 9. Our program leadership, you can see on the top left, our chair is Dr. Kirschblum. He's just an amazing clinician. He took care of Christopher Reeve. He's very dedicated to our program and all the residents. He's, you know, always a text or an email away. He responds very quickly, and he's always looking for resources and how to help us become better. And our program director is Dr. Brooks, and our APDs are Dr. Donovan and Dr. Liu, who are also just a text away, and they're very invested in our program and our learning and our growth and becoming good physicians and people as well. All right, so as I mentioned, we have 8 spots. And
Can you just double check, sorry to interrupt, to make sure that you're in presentation mode?
Let's see. All right. I'm not sure how. Are you having trouble seeing the slides?
It's there. It's just showing some of the side document recovery information. It's fine. We can see it if you want to continue.
That's okay. Oh, I'm sorry. I'm not that familiar with Zoom. So if you guys can see this slide, I think I'll keep going for now. And if I have time, I'll try to see if I can figure that out.
Okay.
Sorry about that. So with we do have there are 2 different rotation sites that our residents do rotate through.
Are you guys able to see it now, or did that change anything? Okay.
Sometimes under slideshow, it will give you the option to the top there.
Here? Let's see. Does that work?
Is that better?
Okay.
Okay. So there are a couple sites that our residents do rotate through. Our home base is our Kessler Rehab Hospital, where you know, one of the top programs, and every year we are a standalone hospital. So that means that we're not attached to any tertiary hospital. We also rotate through Children's Specialized. We do have a VA site. We do also go to our University Hospital, which was previously known as UMDNJ. It's located in Newark. It's a level 1 trauma center. So a lot of diverse patient population goes through there. A lot of pathologies will also come from University Hospital. So a lot of the gunshot wound victims that are SCI or a lot of big strokes come through there. And we also have our hospital special surgery where we can do rotations at, and that's one of the #1 orthopedic hospital in the US. We get a very good MSK exposure there. And we also have some private practices where we rotate as well. So in addition to an academic setting, you do get exposure to private practices just to see if that's your cup of tea as well. In terms of academics, so a lot of this information, as I mentioned before, is all on our website. On our, if you Google Rutgers PM&R program, you'll find them. We do have weekly didactics on the mornings, 8 a.m. to 12 p.m., and this is protected time. So our attendings can function without the residents. They don't completely depend on you. There's no scut work or anything. That time in the morning is strictly yours. So no answering pages, no clinical care that you're responsible for. You're just there to learn and listen to all the lectures that are given by attending. So residents do sometimes offer to give lectures, but primarily all our didactics are from our core staff. We also have our monthly grand rounds, as well as journal club, different specialty clubs as well. And we also, something that sets us apart is the workshops and courses that we have in addition to didactics. So we have a very strong ultrasound course that is around, I believe, around more than half the year, where you go through and you're able to learn anatomy very well and be very proficient in ultrasound tech performance. And you also get an electrodiagnostics course, which is also several months that you can be an independent technician and learn how to interpret these studies, and also have a cadaver course. So we have access to the anatomy lab from the New Jersey Rutgers NJMS students to really hone down on your MSK anatomy. And we have the fresh frozen cadavers. And this is something that, you know, as I'm interviewing for fellowships, this is really expensive, and sometimes these pharmaceutical companies like Medtronic spends lots of time to try to plan these out and these courses out, and we actually are able to have a course all for ourselves and just for our residents, when we can practice different kinds of ultrasound guided procedures. So again, you can be very proficient in this as soon as you graduate residency. In terms of research, so ACGME does mandate research projects and QI projects. And research is really very simple to get involved with our program. We are tied with the Kessler Foundation, and they have grants from R1 grants from the NIH, the Department of Defense, and multiple other nonprofit and profitable groups. And we have model systems in SCI and TBI, so there's just a wealth of data that is really waiting to be harvested to become papers. And that's okay. It's still acting funny.
Yeah. You can keep talking.
Okay. But that's okay. The next slide was just like starting to go into pictures. So, yeah.
Okay.
That's okay, as long as they can see the slides, right?
Mm-hmm.
Okay, so that was a little bit about the education that you'll get with us, but something that's really important as you guys are looking at residencies, it's not only the place that you want, somewhere that will give you the diverse patient population so that you can see different pathologies that you can get exposure to, and a place that has a variety of also just socioeconomic background that plays into patient population. And you can also want, as I mentioned, the volume, but something that's really important is also the culture of the program that you're going to, because this is going to be your home for at least 3 years. And you want an environment where you know that the leadership is invested in you, and that you are a priority, and that, you know, all the attendings are eager to teach and are willing to help you succeed in your career. So this is just a quick slideshow of some of the attendings. You see Dr. Kirschblum there on the top left. He does take time out of his busy schedule to meet with the residents at least twice a month, and usually it's weekly, and just to talk to us about our career goals, about the field of PM&R, and which way that PM&R is evolving. And you can see here, we have really close relations with all our attendings. We have at least 2 attendings in each subspecialty, so that you can at least see 2 different methods of treating patients. And you can really pick and choose and really develop a practice of your own. All right. So adding a little bit to the culture is that you're residents. So we have residents per class. So it's pretty big. So we have around 24 for all our residents, but it's big. It's a big, really friendly family, but it's all small and also small enough that we can make changes throughout the year based on the feedback from all the residents, that our leadership is very receptive to that. And we spend a lot of time together. As you can see, we have didactics usually together. We have a lot of outdoor social events together. Here we had at conferences, we actually typically share an Airbnb because we're really a family environment here at Rutgers. Here we are celebrating a baby shower, and we have wellness activities too every couple months to really just have some fun and remember that one of our mottos is definitely work hard and play hard. Okay, so really briefly about the city of Newark. That is our home base. We're actually, Kessler is around 20 minutes outside of Newark in West Orange, New Jersey. But Newark itself, it's kind of our home base, and we're right outside of New York City and very, like an hour and a half from Philadelphia. We have a lot of things to offer. You know, if you go east, you get to the urban New York City, and if you go west, you have suburban and more rural New Jersey. It's a great cost of living. We have really access to everything around us that we can possibly want. So that includes outdoor activities, shows, music, and just a lot of things to do all year round. Okay. So we'll move quickly on to common questions that you guys might have for us. And then we'll dive into that with Dan and Arlene.
So the first question we commonly get asked is, what should I be doing as an MS1 and MS2 and MS3 and an MS4? I think this kind of varies consistently throughout time. I think even the advice that we've gotten over time is you want to make sure that you are communicating your passion in general for the field. That's just shown generally through consistency and interaction with anything that you're interested in, whether that's sports or volunteering or adaptive exercises and things like that. But in terms of specific things you can be doing, we'd be happy to talk to you specifically about how to tailor your application to PM&R. I don't know if Dan, you have anything to add to that?
I think Dan. No, that's perfect.
What do your graduates do and where do they go? I think we have a long-standing understanding that our Kessler network is pretty large. It spans the entire United States, and we go into all different specialties. I think it reflects kind of the breadth of our training. What do you think, Dan?
No, I think I think that's really true. That they're luckily our residency program has been around for quite a while and has some fun history to it. And I always think that as residents now we are able to really benefit from a lot of the work that the previous residents in years past have done. And some of the great things that they're doing within the field still now. Doesn't matter, what branch of the field of PM&R you're interested in. We've had, past residents do great things in many different areas.
And the next question that we typically get asked is, what attracted us to the field? So I think that in general, when you talk to people, you'll get kind of very different stories, whether it's personal interactions with rehab from a family perspective, or early exposure through like PT or OT. For me specifically, I think it just brought together a lot of different interests of mine. I've always kind of been interested in psychology and the brain. I am applying to TBI. I love that PM&R was really patient-centric and really team-based. So it just brought together a lot of different areas of interest for me. And I think that it's one of the fields that you'll really find that the patient is always at the center of everything that we do, and we take them into consideration in all of the care that we provide. So I really love that.
Yeah, and then for me, so I actually had the great opportunity to do research for several years after I graduated from my undergraduate program at the Kessler Research Foundation before I went to medical school. And so even before I went to medical school, I knew about the field of PM&R in my first day of medical school. Everybody's saying, oh, I want to do this, I want to do that. And I said, oh, I love PM&R, and I can't wait to, I can't wait to do it. And nobody knew what it was. But I had the opportunity to enjoy being there as a researcher, and then coming back as a resident as well. I had already known what a great atmosphere it was there. The attendings and the researchers were all very happy and very motivated and passionate about what they did, and it was the environment that I wanted to be a part of. And I was lucky enough to come back there for residency after I finished medical school.
Yeah, so I'll jump on too to talk about like what attracted me to this program and the program strengths. So I touched on it a little bit before. It's that I was looking for a program that has the patient volume and diversity in terms of pathology and socioeconomic class and everything that I'm going to see. I'd like a standalone hospital just because I like the idea of being an independent provider, that there are medicine consult service who are in-house with you, but you are the primary team and you're really functioning alone in that hospital. And when you're on call, you're the only physician in that hospital, so you get to make all the calls. And secondly is the culture. So as I mentioned, when you join Kessler, you're really joining in a huge alumni network who's really invested in you, and they trust you when you come from Rutgers Kessler, that the name goes a long way because they know that the training is very vigorous and it's very strong, and that we're like great family too. We just get along. And by the way, if you guys haven't noticed, me and Arlene actually live together because we actually like each other. Okay, and really briefly, how our interview is going to be performed, they are going to be all virtual, so stay tuned for that. You'll definitely get more information as that goes on, and hopefully you guys can see this last slide. It has some of our information on there. I'm sure PM&R scholars can give you our information in my email, so you can let us know if you have any questions. But right now, I apologize for all the technical difficulties. I thought that I was like a cool millennial that I knew how to work this, but apparently not. I'm really sorry, guys. But let me stop sharing the screen so that you guys can ask questions. I think we have a couple minutes left, 2.5 minutes left. How do I stop sharing? Yeah. Feel free to like unmute yourselves or put it in the chat.
And 2 minutes left.
Oh, there we go. Good job. Oh, say hi to Nabila too. Oh man, Nabila was one of our previous chiefs who's doing a TBI now at Pittsburgh. So if you want a list of all our where our graduates go, we do go everywhere. We do also have people going to all fellowships. I think in our class alone, we have 1 TBI, 2 FCIs. Dan's doing his administrative everything, Conquering the World fellowship. I have I'm going for pain. And what else am I missing? 1 sports and spine and 1 accredited sports. So we really got everything going. And a couple years ago, we've definitely had PEDS fellowships too. Any questions? Oh, don't be shy, guys. We're really an open book. You can ask us anything about our program, about this whole craziness of doing things virtually. touch on mentorship. Dan, you want to take that?
Yeah, so kind of like what Kathy was saying is just as we have a very diverse group of residents with a lot of different interests, we have the opportunity to have many different faculty in many different fields. And so typically what will happen is, very early on, as you're starting to do your, rotations and starting to meet people, as you start to develop an interest within a specific field of PM&R, then the attendings and the faculty that we have are very open about, mentoring each of our residents, and kind of helping them in their learning process, getting them ready for fellowships and jobs wherever they want to go.
And that wraps things up for us this evening. Really appreciate everyone for participating. This was an excellent session, and it was great to hear about these wonderful programs.